It's Thursday, May 21st, and we thank you for tuning in from throughout Newfoundland and Labrador and across the country. My name is Kathy Dix-Payton, Media Relations Manager with the Department of Health and Community Services, and I will be the moderator for the question and answer session. For today's event, we are joined at the table by Premier Dwight Ball and Dr. Janice Fitzgerald, Chief Medical Officer of Health. The Honourable John Hagee, Minister of Health and Community Services, is joining us via Skype from Gander. Please stand by. Our news conference will begin shortly.
Good afternoon, everyone, and welcome back. I will start this afternoon's media availability with Dr. Janice Fitzgerald for the update today.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us. Since the media availability yesterday, we have no new cases. So our total number in the province remains at 260, with 242 cases in Eastern, 8 in Central, 4 in Western, and 6 in Labrador-Grenfell Health. 52% of cases are female and 48% are male. And by age, we have 22 people under the age of 20, 38 between 20 and 39, 38 between 40 and 49, 58 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 3 people are in hospital due to the virus, and of these patients, 1 is in intensive care. 253 people have now recovered, and in total we have tested 10,983 people. With the low number of active cases currently in our province, we're in a very favorable position to keep COVID-19 under control in our communities. Our collective actions have allowed us to reach this point, and the onus is on each of us to keep this momentum going for the foreseeable future. As we've seen in other jurisdictions and are beginning to see here at home, this does not mean that we cannot resume daily routines and things we enjoy. Rather, it just means we have to do so a little differently, slowly and with caution, so that we do not undermine the advancements we have each worked so hard to achieve. The more patience and determination we exhibit right now, the faster we will get back to a more normal way of life. You have entrusted our provincial public health system to protect you and your loved ones, and I am asking for your continued patience and confidence. We have already come a long way in this pandemic, and seeing it through to the end with as little impact on our population as possible truly depends on each of us. The simple public health measures that have been so diligently practiced to date will make the biggest difference. So please continue to stay at home as much as possible, especially if you are unwell. Practice proper cough and sneeze etiquette. Wash your hands often and well, and only go out once a week for essentials. And maintain a safe physical distance from others of at least 2 arms length when in public spaces. Public health guidance related to COVID-19 has been changing as the evidence and our understanding of the virus continues to evolve. As an additional measure to help protect others around you from your respiratory droplets, we recommend wearing a non-medical or cloth mask while in public spaces and where a safe physical distance cannot be maintained. It is important to remember that non-medical masks or cloth face coverings do not replace staying at home if you feel unwell, keeping a safe physical distance from others, and practicing good hand hygiene. When COVID-19 first hit our province, we immediately came together to combine our efforts and focus on one common goal: to protect one another while flattening the curve. Here we are now, a little over 2 months later, and we have done just that. Clearly, this shows what we can do together as long as we remain united in our actions. Moving forward, this same connectivity will be instrumental in helping us preserve and protect our communities until this pandemic is safely behind us. While we're not quite there yet, we must remain strong and resolute in our efforts to do so. Hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald, and good afternoon again, everyone. And, well, we're very pleased to be able to say that there's no new cases again today. That's 0 cases, and that's reason enough for me and on behalf of all Newfoundlanders and Labradorians to once again reach out and say thank you. It's been said many times that change is the only constant in life, and there's a lot of truth to that statement. We've all heard it. Newfoundlanders and Labradorians, we know as a population, they've been well versed to change over the years. And we know in our province how to adapt to what have become many new realities in our lives. But we also know that when we speak of change, that most people think that change is not always easy. So during a time of change, it's not easy to figure things out because it takes time. If there is anything that we know about people, that more of these days and time to think, that as we sit during these COVID pandemic days, we often go for walks and strolls and so on. It's there that we get the time and to think and to reflect on how things were in the past. So it's not unusual for us to reflect and think about days in the past. And for me as Premier, I'm with you there. I would like nothing more than to see this province fully open up tomorrow and look at the way things used to be. For us, just to simply be able to stop by a convenience store and drop in unplanned, or drop in on a family or friends, just doing so unplanned. The thing is that in due time, that we do know, however, that we will adjust and our economy will open up. But to arbitrarily just open the doors without planning in this new COVID world where we live, that would be irresponsible. Change means that we cannot go back to our normal lives. We must prepare for what is a new normal. Going back would mean going against everything that we've asked you to do over the past few months. Now, during this time, we've been putting in measures in place to support you. People have been working extremely hard on a number of things. Now, one of the plans that we put in place, one such plan, was living life in Newfoundland and Labrador with COVID, what that would look like. The second thing that we've been putting in place and working on is what the economy would look like as we learn from COVID in our province. So it's at these times that people would ask questions. It's no wonder, because they want to plan their lives as well. So some questions would be like, how can everything operate with this new normal, with the goal is to have people's health in the forefront? So I understand that this can be difficult for business owners, and I appreciate there are many people that want to get back to work. Many people miss their workplaces. They miss the networking, they miss the socializing, and we all want to see that too. But we have to remember the decisions to reopen has to be one of balance. So with that balance comes the need for responsibility. That means working with our public health officials and listening to what science says, and also just looking at what's happening in other jurisdictions that have opened up. We must do everything that we can to prevent another cluster, prevent future outbreaks within our province. The health of each resident in our province is our priority, and this all factors into how we make decisions to reopen our economy. Now, a few days ago, we moved to an alert level 4, and as we now start preparing and gearing ourselves towards alert level 3, that is, if all goes well, we could be there as early as June 8th. Alert level 3 puts our focus on controlling the transmission from further relaxing public health measures. You could see changes to public spaces and gatherings, recreational activities, healthcare, potential of even more businesses reopening. But all of us at this table have been talking about how important it is for all Newfoundlanders and Labradorians to work together. So if you look at the description of Alert Level 3 on your COVID website, you will see that it also lists your responsibilities. So as residents of our province, we have a responsibility to uphold. It is not just about keeping ourselves safe, but it's also about keeping those around us safe. So as we continue to work together to get through this, we will also continue to work together with our community, our businesses, and our industry as we plan to reopen our economy. So while we've been working alongside our business communities and throughout our province on a plan to reopen, there have been many questions that have been posed. Things like, well, how do I operate in this pandemic, and what do I have to put in place to protect my staff and protect customers? Although our public health officials are putting measures in place from a public health perspective, the questions you are asking, let's not forget about, so when you ask those questions, I remind you that we should not forget about that we have a business response team set up under the Department of Tourism, Culture, Industry, and Innovation. Now, there's a team of people there who are available to provide businesses, organizations, employers with information and advice about operating in the context of COVID in our province. Now, this team at the department will provide businesses and employers with information about the various alert levels, that we put in place as part of living with COVID in our province. Now, often, which is not unusual, sometimes when you get involved in those conversations, this will lead to even more questions. The business guidance team will work with them to determine where the businesses fit with all the alert levels and business descriptions. So what I'm saying here, there are supports in place as we deal with the public health measures, but we also put in place a different group of people to support you on those questions. This team that I'm referring to will direct business owners to various resources and guidelines and how to operate in a way that protects your workers, your clients, your customers from the potential risk of COVID-19. So essentially what I'm saying here, this is about planning for moving to alert level 3, about all of us working together. So in our province, if you own a business or you run a business for someone or an organization in your province, this business response team is here for you. And you can reach them by dialing 1-833-771-0696. And of course, you can email your inquiries to covid19info@gov.nl.ca. So what I've outlined here is just one of the many supports that we're putting in place as we work towards what is a new normal. But the important message here is that we all have a responsibility as we are now in alert level 4 to move to alert level 3. It will take all of us working together. We know that in every corner of the province, people have been impacted by this pandemic. Sometimes it could be families, it could be businesses, as I just mentioned, but it also could be small organizations, many of whom hold community fundraisers. They have some very good causes that they organize those fundraisers for. And now in these times, they're becoming more creative and trying new ideas. Now, one such event that I want to talk about today is I Love You Day, which takes place tomorrow in my hometown of Deer Lake. It's an event that I typically attend in my community every year, and I get the privilege to celebrate Hyla's memory. It's an event that has had special significance to me, as even though Isla was just a little girl, she was wise. We all learned a lot of valuable lessons from her. She taught me how to deal with adversity and always reminded me to look on the bright side of life. And the colors that she had in her world really showed how she felt always about positive thinking. Now, when Isla passed away, her parents started I Love You Foundation to help other families to be the same way, to have these supports with them, just like they did when they were going through their challenge in life. So it was the family's way of giving back. The reason that I mentioned this today is because I know that there are many people in communities all across the province that will hold similar events. The people who organize All of You Day and the foundation had to start thinking a little bit outside of the box, because this is indeed a new normal. They questioned about how they could hold an event this year and really what options they had available to them. As I mentioned, in the past years, they would host a major concert, and people from all over would gather to enjoy music, family and friends, and donate to the All of You Foundation. And for the sake of the collective health and well-being during this pandemic, we know that big events like those and concerts are not possible right now in our province. With that being said, I'm happy to see that the All of You Day is adjusting to a new normal and using a virtual format. They have organized everything from an online bake sale and an auction to an Unsung Hero Award. They've organized a door decorating contest, balloon deliveries, even a joke contest. Well, that makes sense. For those of us that knew Isla, she was a young girl that loved telling jokes. It was one of her most favorite things to do. So today I would say let's take Isla's advice. Let's continue to work towards the things that make a positive difference in people's lives. Things like helping families during their time in need. So it is my hope today that as we move forward, we will look at ways in which we can bring residents and communities and ultimately our province together. Think of what we're doing through our all-party joint committee as we meet every day, through our MHAs, our ministers and departmental officials to help you and your family during this health pandemic. We will continue to put new supports in place and maintaining and even enhancing what we already have in place as we all learn to adjust to this new normal. So it is about supporting each other. It's where we will see the positive change. So it doesn't work unless we're all in. So thank you for today, and I will now turn it over to Minister Hagee for his comments today.
Thank you very much, Premier. Again, zero, and another sign of success. Odd to think of it in those terms in some way, but we really have, as a province, come together, as Dr. Fitzgerald and the Premier have said, to reduce the risk from COVID-19. So, again, well done to everybody who's participated and done their part and often gone above and beyond. For those of you who are feeling challenged by this, I would encourage you not to look for loopholes. And for those of you who are worried about what may be going on in the community, there are always report forms if you feel that level of concern, and I would encourage you to use them. From the point of view of loopholes and information, the website COVID-19 is the place to go. It will provide you, as it has done for several weeks now, with up-to-date clinical information, with frequently asked questions, and to build on the Premier's theme about the business response team, it links through to that area. So for those businesses, for example, who would look to being considered to open up in level 3, there are more detailed comments and requirements for you so that you can organize your activities and build towards that opening. For those of you who may fall in level 2, it's a little bit more of a work in progress. It's evolving at the moment. And that really represents the fact that we're doing this in stages and we're doing it in a thoughtful and considered way and looking at the best evidence that Dr. Fitzgerald and Public Health Agency of Canada can provide. We need to look at these resources to develop a new look for Newfoundland and Labrador, a new way of adapting to the presence of COVID-19, because all the experts locally, nationally, and internationally tell us that this is around for some time yet. And so we need to adapt. We need to know that it's with us. And we need to remember that the virus moves only when we move. So, again, we hold fast, as Dr. Fitzgerald would say. We need to continue doing what we have been doing. We look after our bubble, bigger as it may be. We protect it, and we don't disrupt anybody else's. And I think on that note, Premier, I would stop and hand it back to you.
Well, thank you, Minister. We'll now turn it over to the media for the questions for today.
Thank you, Premier. For the benefit of our speakers, we have 6 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they're registered for today's call. Please do not press *1 until your name has been called. Following this, should time permit, there will be an opportunity for single questions. This call will end at 2:59 p.m., and any further questions can be emailed. Our first questions today are from Elizabeth Witt of All Newfoundland Labrador. Please go ahead.
Of Independent Business released a poll today, and out of all the provinces, put Newfoundland and Labrador last in terms of businesses that have fully reopened. We all have the same incubation period for the virus. So what does it say about our province and how it differs in policy to other provinces?
Well, once again, we have a plan in place. Our plan is quite different. Many provinces have been at various stages. So I've seen over my 30-odd years in business too, it's not always those that get to the start line and get off to a fast start that actually finish the race. So, for us, it's making sure that we put the proper plans in place. We work very closely with our business community. We are doing that, but keeping front and center foremost in our mind that it is around health and public safety that we make our plans around. So we'll move into alert level 3 based on the province working together, as I just mentioned, and you will see more businesses that will reopen then. So, for us, when I look at the report card today, it's, around 67% of businesses right across this country that are still closed. We are in the high 70s of businesses that are still closed, but we are planning to reopen more businesses as it's safe to do so, and as those businesses get an understanding of what their requirement would be to open. So I would anticipate we will be all at various levels in reopening, but our focus right now is being able to do so safely within our businesses and with the, in general population in particular, and that we don't have to get a setback. So opening up early doesn't mean that you're not going to have a setback in the future.
Thank you. And this question is for Dr. Fitzgerald. When the second wave arrives, can you go into a bit of more detail about how the measures taken during the first few months will help guide you in that second wave?
So when the second wave comes, we'll be looking at the epidemiology, and we've also been getting advice from people who are doing modeling, and we will look at that, and we'll all of that information plus our experience and what the experience of other jurisdictions has been will inform how we respond to that second wave and what exactly our responses will be. We'll have some more information about what has happened as we've reopened as well, and so that will inform our decision-making process. But to make predictions this far out as to what exactly we would do, I don't think would be helpful at this point.
And you kind of touched on something I wanted to bring up as well, modeling. I was wondering when Dr. Rahman is expected to share his updated model for the province, and will that model include possibly an estimated date when the travel restrictions in the province could be lifted?
So we've been working with Dr. Rahman to talk about how modeling can help us in the reopening process, how it can help us look at when to restart some of the restrictions that we had before in those situations. So I don't know that he's really looking at sort of another modeling projection at this point. It's more trying to inform our decision-making process as we go further. Minister, I don't know if you have anything to add to that.
Yes, certainly. Thank you, Janice. Dr. Rahman provides the department on a weekly basis with rolling 30-day projections of numbers and potential for service challenges in terms of what we need to keep as capacity, as spare reserve. I think the question about timing, the two are intricately linked. When we reopen our borders to travel within Canada, that will be the next major increment of risk, assuming everything goes all right between now and June the 8th. And then we will have to see what happens there. The feds have kept the national borders closed for another month. I know the BC public health system and the premier there have kept the land border there with the states firmly closed. They're not happy about the situation. Because the other piece of this is not so much what's happening in Newfoundland and Labrador when you look at travel, it's what's happening in those places that people would be coming to this province from. And so there is no playbook for this. There is no playbook anywhere in the world for this that isn't more than a couple of weeks or a couple of months ahead of us. So you only got to look to China and Jilan province now to see what the next or the third wave could look like. So we need to keep a close eye on that. And as Dr. Fitzgerald says, looking more than a month or two out is really speculation. And that's what Dr. Rahman's focus is on, operational in the next 30 to 60 days.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I have a follow-up to Elizabeth's first question in regard to the CFIB survey. Economically, or I'm going to start with public health measures have helped to this point, but economically, this is hurting people and businesses. At what point does that damage outweigh the benefits of COVID measures?
Well, the problem is that if you open too early and you have a flare-up or a setback, that will happen will have a further impact on businesses. So we've been working very closely both at the federal government level and here at the province as well. So we, as I just mentioned, 67% of businesses, according to the survey that you've just mentioned across this country on average, are closed. So in Newfoundland and Labrador, we have about 22% of our businesses open. So we're within the 10%. Yeah, of course, we want to get our business community, want to get people back working. But if we don't do it safely and don't do it with a plan, making sure that we can respond to a flare-up, if indeed that should happen again, well, then that would only have more impacts and would not do much for business confidence in Newfoundland and Labrador. So our plan, we've got a good plan in place. I think we were one of the last provinces to put those alert measures in place. And I think that when other provinces looked at what we had here, they kind of liked it. They were further along than we were. BC has been doing this since January, as you know. Ontario has been doing this since January. So we are a little later on in all of this. So it's not anticipated that we are many weeks behind where other provinces would be. We're going to move it along. We're going to move it along with a strategy. We're going to move it along prepared. We're going to move it along with planning. We want to get our business community open up too, but we want to prevent further setbacks in the future, which could even hurt businesses even more.
Thank you. The charter challenge against the travel ban was officially filed yesterday. They also want the courts to suspend the travel ban pending the outcome of the case. What is your response to that?
Well, there's no plans right now to suspend the travel ban. We'll have some discussions on this, but keep in mind the reason why this went in place was to prevent the spread of COVID coming into our province. The minister had just said already that the biggest exposure that we would have would be through people bringing this into Newfoundland and Labrador. I think today we have about 4 active cases that we know of in the province. We know there's more, but we know of 4 active cases in our province. So the exposure to Newfoundland and Labrador and the risk that's associated with opening up those borders, at this particular point in time, given what's happening in other provinces, could add some undue risk to Newfoundland and Labrador. We know about the health of Newfoundlanders and Labradorians. We're an older province. We have more chronic diseases than other provinces would add. So all of these are factors, as is PPE, contact tracing, our healthcare system. So we're in good shape right now. What we're trying to do is prevent further exposure to Newfoundlanders and Labradorians.
Thank you. My final question. An opinion article was released this week stating that the pandemic is an extended holiday for public sector workers. Wondering if you have a response to this.
Well, we have many public sector workers that are working from home, as we've had the business communities. They have many of their workers that are working from home as well. So they're providing a lot of benefits, a lot of services, a lot of information that's required to make decisions within our province. So a lot of people are working from home. Right now, we still have a lot of people, too, that are working, within their offices and so on. But we have a public sector worker right now that's continuing to support Newfoundlanders and Labradorians in all regions. So this is not a holiday for public sector workers. Many of them are working very hard providing services to people in Newfoundland and Labrador. I would argue that if you look at nearly somewhere between 18 and 20,000 people that are associated with health care in our province that are actually on a holiday.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Is loosening its next series of restrictions tomorrow. They recorded their 14th straight day of no new cases yesterday. We're doing it today. Dr. Fitzgerald, what is it that's different in terms of the epidemiology here versus in New Brunswick that would lead to such different approaches to the timing of moving from one alert level to the next?
So we took the evidence that we had. We took the advice that was recommended at federal, provincial, territorial levels, and we developed our plan based on that. I can't speak to what information other provinces have used and what has gone into their decision-making plans, but we made the best decisions the decisions that we felt were best for the province with regard to the prevention of COVID-19 spread with the information that we had at the time.
If everybody is working off of same recommendations in terms of, or you would think the same information, does this come down to just a difference in strategy? And would you say that moving from one level to the next is imprudent, given that that in Newfoundland and Labrador were taking twice as much time to do so?
So I think that, I can't comment on what other provinces have, or how they've reached their decisions, or what decisions they have made. They have their reasons for doing so, as do we. So I think that, I don't really know that I have a different answer to give you.
I think, Patrick,
Okay.
when you look at it, every single province has a different plan. BC is different than Alberta. Alberta would be different than, Saskatchewan and Manitoba and Ontario. Ontario is, pretty much, they have a lot of businesses closed that would be in Ontario as well. Quebec's, opening up a little bit. New Brunswick has been opening up quite a bit. PEI and Nova Scotia is kind of where we are. And so every province is very different. Every province has a very different plan. They're in a different position when it comes to the age of their population, the types of work, that would go on, in each province. So, we're not that far behind when you look at where we are, when you look at it in a monthly, 30-day time frame. So, we're going to get there, but we're going to get there when it's safe. We're going to work with our province, making sure that we're prepared. And this is really all about planning for us, making sure that we have the business community, public health officials, working together, as well as people in our province that continue to do the great job of following public health guidelines.
Another comparison with New Brunswick, from a financial point of view, in Newfoundland and Labrador, we said that we're not going to give a fiscal update until the federal budget comes out. But New Brunswick has released their such a document today. Are you still keeping with that approach, or should we expect to see some sort of fiscal financial update in the near future?
No, actually, last week at this very table here, I mentioned that we would have a physical update based on the March 31st numbers. Some of these changed, of course, as we were preparing for a budget. We saw some significant changes, in mid-March that had a big impact, on what would have been our budget year. So these numbers are being tabulated now. And yes, I said last week that within 2 weeks that we would have this physical update available.
Thank you.
Our next questions are from Ben Murphy of VOCM News. Please go ahead.
Thank you. Dr. Fitzgerald, chief medical officers of health from all across the country meet pretty regularly with Dr. Tam. Just curious as to what kind of best practices are you hearing from them that you could maybe adapt to ease the restrictions here?
So we have meetings on a regular basis that discuss many different facets of COVID-19 and what the response should be, from reopening to testing to all kinds of different things. So we are using that best information that we get to inform our decisions, and we'll continue to do so as we move forward.
And I know you mentioned that, obviously every jurisdiction is different, but BC CMOH, Dr. Bonnie Henry, has said that unless residents can really see and understand the reasoning for these restrictions, they won't really follow them. And now with 2 weeks of no new cases, only one outside of hospital, people are no doubt having more difficulty understanding such strict restrictions. So I guess, how can you expect people to be so disciplined and follow these orders for another couple of months with our numbers so good and low?
Well, I would say if we want to keep our numbers low, as I've said every day, we do have to consider these public health guidelines that we have put forward with regard to, physical distancing, limiting your contact with people outside of your household bubble, staying home if you're unwell. These are all things that you need to do. And I think we have explained why people need to follow this guidance to reduce the risk. And I think people have listened and they've done a good job with that. And I think we have explained why we have chosen to go through level 4 as we have. And I think that people do understand why we need to do that.
I think we need to. Yeah, if I could, John, just for a second. I think we need to put this in context too. I think we come to this table. We're very happy to be able to report 0 cases, but as we sit here, there's still 80,000 positive cases that we've had within Canada. Many of them are still active. We've had 6,000 deaths of Canadians. If we were sitting at a table 3 months ago and saying that within 3 months there's going to be 6,000 Canadians pass away from COVID-19 in Canada, I think that would have been alarming news. Well, that's essentially what's happened here. So, we will reopen the economy, but we must do it when it's safe to do so, and we must plan for it and be prepared if we have a setback. This is not about being resistant or about being stubborn. This is about making sure we put public health safety first, protecting Newfoundlanders and Labradorians, and making sure that we open up our economy, that we're best prepared not to have another setback.
Comment I was going to make then around explaining the logic that Dr. Fitzgerald, as she explained it to me, is around the nature of the disease. It can take up to 14 days from exposure to the virus to actually show symptoms. If you then pass that on to somebody else, it takes them in turn another 14 days maximum to do that. If given the fact that we have a very elderly population compared with other jurisdictions, we have some of the highest incidences of other chronic diseases, particularly diabetes. We've got 11% of our population who are diabetic, and that is probably the single most identifiable risk factor for a trip to the intensive care unit if you catch COVID-19 as well. If you add those facts together, 28 days is a reasonable period to make sure, from a provincial point of view, you're as good as you can be for this first increment. Whether that needs to be that on a go-forward basis afterwards, well, in 14 or 17 days, we'll have new information from Public Health Agency of Canada and from other sources. If it still needs to be 28 days to level 2 from 3, if we can do it, then we'll make that case. And if it's different, we'll make that case too, because there is no playbook for this. But the reason that everyone's happy that nothing is happening is because of the hard work that's been done. And the travel issue, for example, New Brunswick has turned away every day for weeks at least 35 people at their borders, as well as repatriated on one weekend 19 individuals that I was aware of by air. Our travel restrictions are nowhere near as harsh as Quebec's or PEI's or New Brunswick. So they have had that success in that environment. We don't have that environment, so we take what we've got and we act out of an abundance of caution. I would argue that that is good public health and responsible public health.
Okay, great. Thanks, all three of you, for that. And Premier, PC's Helen Conway-Ottenheimer has joined the call on government to address women's issues during these daily briefings and reopen the House to address women's issues. My colleagues and I have asked for this multiple times, and we've been told we can just reach out to Minister Haley, yet we've had numerous guests join this panel who none of us have asked for, which is great and important, but we talk so much about having the first standalone department for the status of women, yet Minister Haley has been essentially silent, and even when she did respond to, I believe, the CBC, she had very little to say. And if it can be done with stuff like mental health and others without asking, why do we need to continuously ask for a representative for women to address these issues?
Well, as I said in the past, Ben, that if all our ministers are available to the media for, I think yesterday there was maybe 2. I'm not sure if you had reached out or not, or if anyone from VOCM had reached out, but I think there was an interview that was done with NTV and another one that was done with CBC. We have brought in to this panel, I think, one other minister. I think that was Minister War on an education issue, which was very early, and where essential workers were being discussed and closure to schools and so on. So we've and the rest of the people that we would have been brought in would have been community people that would have been advocates. We've had our seniors advocate in. We've had representatives here from Channel. We've brought in someone who had lived with COVID and through the experience, which was important, and someone I think we had here to properly install a mask. So typically this is who we brought into our panel, but if you need access to any ministers, MHAs, these are available. So I don't know if you've reached out or you tried, but I'm sure this can be coordinated for you or some other reporter from VOCM. I know NTV and CBC did that yesterday.
Yeah, I know that. I know I can do that, but we haven't had to do this for anybody else who has joined this panel. So, why do we have to do this now? It seems like she just really doesn't want to get up in front of the microphone.
Well, I don't know if you've got questions that, I've answered quite a few questions on violence and women's issues and the the Office of the Status of Women in our province. There's been quite a few messages that I've put out there, just like I would have, on education and tourism on every single day. But this office is a standalone office, as you know. It's the only one in the country that has a minister that is responsible for the status of women. They're fully engaged with, with groups within our province. That's what I've been told, as they are working with their federal colleagues. So many of those ministers are currently working from their home. They're not in St. John's, as John is, participating today from his home. So I'm sure that if you reached out to the department, if there's anything that, questions you need to ask, I'm sure through VOCM, like yourself, you're not shy. I know that. And if you need information, need an interview, I encourage you to reach out.
Thank you.
Our next questions are from Peter Jackson of the Telegram. Please go ahead.
Sorry about that. Dr. Fitzgerald, can you explain what specific challenges you are considering while deciding whether a jury trial can go ahead in the province?
So we've had a meeting with the Chief Justice and discussed how jury trials could go ahead. Of course, the challenges are, number one, with jury selection itself. It tends to be a large group of people, so from a mass gathering point of view, that's a challenge and something that will have to be overcome in order to enable jury selection. And then just the setup of the trials themselves. Obviously, we have to consider physical distancing and having enough space to allow that to happen. So those are all things that we discussed with regard to the resumption of jury trials.
Okay. With regards to the court action, what effect would a finding against the province have on our ability to limit the entry of Canadian citizens into the province?
I think that would be for the court to decide.
Okay. And just a clarification, when you say Quebec and New Brunswick are turning away travelers, are you referring to Canadian citizens or U.S.? All Canadian?
My understanding is they are non-residents.
No. I'm sorry, non-residents of?
Non-residents of the province. The issue with New Brunswick, I know for certain, has risen with Newfoundlanders and Labradorians who are coming home for appropriate reasons, and yet do not have Newfoundland and Labrador documentation handy to support that. And I know of at least one case where a member of the House intervened to provide them with a letter, and they were let through New Brunswick to get to Nova Scotia to get to the ferry.
Okay, thank you.
Our next questions are from Meg Roberts of CBC News. Please go ahead.
Laser tag and airsoft business, it has received permission to reopen their outdoor park. How can we relax restrictions for them and not for others, such as tennis?
I'm sorry, I missed the first part of your question.
Sorry, according to a paintball, laser tag, and airsoft business, it's received permission to reopen their outdoor park, and I'm just wondering, how restrictions can be relaxed for them and not others.
So I'm not aware of that happening, but I can certainly go back and see if I can find an answer for that question for you.
Okay, we got a press release from them. My next question is, we hear the province has received a request from the Medical Association to get more PPE for community-based physicians, doctors, who might have their own clinics. What's the government's response to them?
We have contact information available to either the Medical Association or the community physicians through the local regional health authorities. There are kits available for those doctors, physicians who feel there is a need to have a face-to-face consultation. We have actually, I think, significantly reduced that potential demand. As of, last week, we'd had over 96,000 virtual consults performed across primary care in this province. So It is there if it is required, and I couldn't tell you what the utilization has been of that. I haven't heard of any problems in that regard lately.
Prince Edward Island is moving ahead its next reopen phase by 2 weeks because they've had such a long stretch, like Newfoundland and Labrador, with no new cases. Are you considering changing that June 8th date at all?
At the moment, we're not considering changing that, no.
Okay, thank you very much.
Thank you. We'll now start single questions, starting with Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
Touched upon yesterday, given what we know about the virus, but is it possible if Newfoundland and Labrador still has the travel restrictions in place for several months, we might not see the second wave in the fall?
So we know that our biggest risk of an outbreak right now is importation. We hope to keep the numbers of cases as low as possible. However, we are still having people come into our province. That's happening. People who are essential workers and who are providing essential services are still coming in. So there is still that risk. But, in an ideal world, that would be the case. But, again, as I said yesterday, I'd be exceedingly surprised if that was the case.
I think the background to that question also has to be considered in the light of Dr. Henry's remarks, for example, yesterday from British Columbia and indeed the historians at Memorial here. There has been no pandemic that hasn't had a second wave. We don't have a specific treatment for this virus. We don't have a vaccine in the foreseeable, realistic, medium term. So the virus is still out there. It's not gone away, and that's why we've framed all our comments at these meetings in terms of adapting to the presence of COVID in the world in which we live.
Thank you. Our next question is from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. We know that moving from level 4 to level 3 was a 28-day period. In terms of moving from level 3 to level 2, I know we're not in level 3 yet, but with the good numbers we have been having and how we've been adapting, have we been given a timeline and how long we'll be in level 3?
No, at the moment we don't have a timeline for that. As I said before, we will be considering our epidemiology and the epidemiology elsewhere in Canada and the world as we make those decisions. And we'll also be looking at what the effects of these changes have been on our epidemiology here.
Thank you.
Our next question is from Patrick Butler of Radio Canada. Please go ahead.
Has said that there are several thousand exams and appointments that have had to be put off since over the past couple of months. How much progress are we making in terms of, making up that backlog, and in terms of how long that might take? Is there any idea of how I guess the timeline of making up the backlog? Sorry, not a very well formulated question, but I hope you understand what I'm trying to ask.
Was that in context of healthcare appointments, Patrick? I missed the beginning.
Yeah, sorry, specialist appointments and tests or endoscopies, things like that. There's a backlog of thousands of those as of right now.
Yeah, there is. And what's happening now is those are what's called being triaged. They're being sorted so that those that weren't emergent or urgent but are time sensitive will be done ahead of those that may be an annual checkup, for example, or a 2-yearly checkup, those kind of things. The ability to absorb that backlog will be limited by PPE and the availability of appointment slots in the new COVID era, because there will be, I'm sure, new infection prevention and control measures to be taken in endoscopy suites between cases that will actually potentially reduce the throughput of those units. So those are currently being worked through. I am aware that each RHA has plans for that, and my understanding is that those cases are now being begun. That backlog is being addressed. So how long it will take, we're not in a steady state, and in actual fact, I honestly don't think we'll get to a steady state until we get to level 1, because the safety net for each change in alert level is capacity within the healthcare system. If we use that capacity for planned procedures, routine procedures, it is not available as a safety net.
The next question is from Ben Murphy of VOCM News. Please go ahead.
Thank you. Dr. Fitzgerald, an Abacus data poll came out today showing some 62% of Canadians are ready to get back to organized sports and group physical activities. Alert Level 3 permits medium-risk outdoor recreational activity can resume, like team field sports. Just wonder if you can give us a bit of a better idea of what's going to be allowed in terms of those recreation and field sports, and just what people can look forward to.
So we've engaged with Sport NL and some other federations of sport to talk about just that, those organizations have talked to their members to see, for them to look at how they can return to sports safely. We hope that we'll be able to allow some field sports and outdoor sports to occur. We know that the risk of transmission is lower outdoors than it is inside, so we will be starting with outdoor sports. We also know that the risk of transmission is higher when people are breathing heavily and, there's a lot of contact and intense contact like some of these field sports can have. So we have to be cautious when we're looking at that. But we certainly are hopeful that we will see a return to outdoor sports in some form, although it may not be exactly as we're used to playing them.
Thank you.
The next question is from Peter Jackson of The Telegram. Please go ahead.
Hi, I want to follow up on the question I believe I asked yesterday about medical clinics. With specialists have to perform certain procedures and see their patients in order to do this. And I'm wondering how they will be able to afford overhead if they have to significantly reduce that kind of procedure or that type of consult.
Well, the issue around physician overheads, I would leave to the Medical Association. Certainly, a significant proportion of procedures over the previous decade or so have been transitioned or indeed continued within regional health authority facilities. So for those, such as endoscopy and some of the biopsies and those kind of things, there would be no change in physician specialist overhead as far as that is concerned. So again, I'm a little loath to go into too much detail around overheads and physician billing, simply because we are already in a period of formal negotiations with the Medical Association, and both of us have agreed not to negotiate in public.
And our next question is from Meg Roberts of CBC News. Please go ahead.
Since the beginning of COVID-19, but Canada's Chief Medical Officer of Health is recommending Canadians wear non-medical masks as we start to reopen. When we go out in public, should we be wearing a mask?
So the recommendation is if you are not able to physically distance, if you're in a situation where that's not possible, then we would recommend that you wear a non-medical mask to reduce the spread of your respiratory droplets to someone else. And we recommend that for everybody in those situations. So if everybody is wearing a mask, then that offers protection for everybody. If you are out on your own and you're able to physically distance from people, you're just going for a walk by yourself, then know that wearing a non-medical mask is not necessary in those situations. It does not replace physical distancing. It does not replace any of the other public health measures that we have in place or that we're recommending, such as hand washing and physical distancing. So, it is another useful tool, but it is not a replacement for those tried and true methods that we know.
Thank you very much.
Thank you. We have time for two quick questions. So, operator, when they press star one, if you could identify the reporter, please.
The next question is from Kellyanne Roberts from NTV News.
Thank you. We're 2 months into this now here in Newfoundland and Labrador, and obviously when we look back potentially a year from now, months from now, there'll be a lot of lessons learned. To this point, what has been the biggest lessons learned for all of you?
I guess we need the time to reflect on it, I guess. But I think, for me, is how quickly, this virus can move within our communities, the impact of us having. When I look back, as I just said, if we think about if we were sitting at a table back a couple months ago and someone would have said that it would be 6,000 Canadians that would have died, I think that would have been an alarming and a startling number to all of us. We've lost 3 people in Newfoundland and Labrador as a result of this virus. There's 6,000 Canadians that are gone. We've had 80,000 Canadians that are still impacted or have been tested positive. So I think for me, the lesson that we learned is one around preparation, one as we plan for, and this is important now, the lessons that we learn now, given the fact that we're all expecting a second wave to occur, is that we better prepare, better plan. Nationally, I know as Premier of a province, we work very hard with all our premiers and with the federal government. So there's a lesson to learn there that regardless of political affiliations and stripes, that people can work together. That's the political lesson I think that I've learned. But from a health lesson I've learned is one about preparation and planning as we potentially plan for what could be a second wave.
Thank you.
Next question.
Please press star 1 at this time if you have a question. There are no questions registered at this time. I would now like to turn the meeting back over.
Thank you very much. The time for questions has ended. Please join us again tomorrow at 2 p.m., 1:30 in most of Labrador. Have a great evening, everyone.